Hi everyone, this is Dr. Praveen S. Patil here. Today I am going to talk on the medications used in nebulization. World Health Organization estimates 339 million people worldwide have the asthma, whereas 34.3 million people in India have asthma. So, in case of asthma, COPD, we are commonly using the nebulization, and in that nebulization we are using different kind of medications. So those medications, commonly used medications, are Asthalin, Levolin, Ipravent, Duolin, Budecort, Fluticasone, Budesonide, Foracort, that is Formatrol and Budesonide, Inhalex, Mucinac, Tobramycin, so that is Tobramycin, Hyperneb solution, and the Glycopyrrolate. Dear friends, today I am going to talk on the dosage and different combinations when to use which medicine, pediatric and adult dosage of that. The first one is, and the most commonly used medication or the preparation in the nebulization, is Asthalin, that is the combination of the salbutamol. Salbutamol is a short acting beta and agonist. It's a short acting. It's a bronchodilator. It works by relaxing the muscles of airways into the lungs, which makes it easier to breathe. So it's not going to act the causative treatment. Asthma is just relieving the symptoms. So the air is dilating the airway. The composition, salbutamol comes in 5 mg per ml and 2.5 mg for 2.5 ml. So 2.5 mg for 2.5 ml is a pediatric dosage, whereas the salbutamol 5 mg per ml is the adult dosage. So we can start with 0.5 ml to 1 ml up to 4 times in a day. It can be repeated 4 times in a day. The levosalbutamol is just an improved version of the salbutamol. This is a same one, that is a short acting beta 2 adrenergic receptor antagonist. But what is the advantage is it reduces the tachycardia, which is commonly appears after taking the salbutamol, so which is not seen in case of the levosalbutamol. So tachycardia and hypokalemia incidents are reduced in comparison to the salbutamol, in comparison to the Asthalin. That is Asthalin and Levolin. These are the brand names. Molecular name is salbutamol and levosalbutamol. It comes in three variants like zero point 0.3, zero point 0.6 and 1.25. 0.3 is for the age group between 6 to 11 and above 12 years, that is 0.6, and 1.5 for the severe conditions. Dosage, 1 respule for 3 times. Based on the age, we can select the respule and it's for 3 times. Whereas Asthalin can be repeated up to 4 times, but this is for 3 times. Next one is the Ipravent, that is the combination Ipratropium bromide. Ipratropium bromide is the anticholinergic, particularly acetylcholine antagonist, which blocks the muscarinic cholinergic receptors. By doing so, it decreases the contraction of the smooth muscles. Used in COPD, that is chronic obstructive pulmonary diseases, emphysema, and chronic bronchitis. See, salbutamol is a bronchodilator. Levosalbutamol is a bronchodilator. There is nothing but the improved version of the salbutamol. Whereas the Ipravent, or that is the Ipratropium bromide, is an anticholinergic. So Asthalin, that is the Asthalin and levosalbutamol and salbutamol dilate the bronchus, whereas Ipratropium bromide prevent the bronchoconstriction. Hence, it is used in COPD. It comes in two variant, that is 500 mcg per 2 ml and 250 mcg per ml. So it can be given 3 to 4 times a day. Based on the severity, it can be repeated 6th hourly to 8th hourly. Next one is Duolin is nothing but the combination of levosalbutamol and ipratropium bromide. So this is used to treat the symptoms of COPD. One Ipratropium bromide prevent the bronchoconstriction, and levosalbutamol, if there is any constriction, it dilate it. There is a bronchodilator. So it's a Duolin is a combination of ipratropium bromide and levosalbutamol. Levosalbutamol, as we know, it comes in three concentrations: zero point 0.3, zero point 0.6, and 1.25. Here in Duolin, it comes in 1.25 mg, and ipratropium bromide is a 500 mcg. So dosage is one adult dosage is one restful 3 to 4 times a day. Next one is budesonide, that is Budecort, is a corticosteroid potent anti-inflammatory to treat the symptoms of asthma. So this is budesonide. It's a short acting. It's a short acting corticosteroid. So we prevent the inflammation in the bronchus. The budesonide comes in two composition: zero point 0.5 mg for 2 ml and 1 mg for 2 ml. Adult, the loading dosage is 1 to 2 mg. That is 1 restful to 2 restful. Adult 1 restful to 2 restful as an initiating dosage, and afterwards you can shift to 0.5 to 1 mg based on the severity as maintenance dosage. The maximum dosage is 2 times a day, that is 12th hourly. Children's 3 months to 12 years, so we can give it. So 0.5 mg. So we get a two concentration, 0.5 and 1 mg. So here in children we are using 0.5 to 1 mg 2 times a day. Next one is Fluticasone. The brand name is Flohale. Fluticasone propionate is highly selective agonist at the glucocorticoid receptor with negligible activity at the androgen, estrogen, and mineralocorticoid receptors, thereby producing anti-inflammatory and the vasoconstriction effect. Fluticasone is a corticosteroid, so as that of the budesonide. The composition is 0.5 for 2 ml and 2 mg for 2 ml. Adult 0.5 to 2 mg 2 times a day, and children's 0.5 to 2 mg 2 times a day. Budesal is a combination of budesonide and levosalbutamol, that is levobutrol. Budesonide, that is a corticosteroid. Levosalbutamol is a bronchodilator. It is a combination of corticosteroid, that is a potent anti-inflammatory, and levosalbutamol, that is a short-acting beta-2 adrenergic receptor agonist. Budesonide, it comes in two variants, that is 0.5, that is only the concentration of the budesonide varies, that is 0.5 and 1 mg. Levosalbutamol remains same in the both the preparations, that is 1.25 mg. 1.25 mg for 2 ml. Budesonide concentration varies, that is 0.5 and 1 mg. Adult 1 to 2 restfuls a day, that is 12 hourly. Children's half to 2 restfuls a day. Next one is Foracort. Foracort is a formoterol, fumarate, and budesonide. See, both are the corticosteroids, and both are good anti-inflammatory. Then what is the difference? Difference is the budesonide is a short acting, whereas the formoterol fumarate is a long acting. Budesonide is a SABA, that is short acting beta adrenergic agonist. Formoterol is a long acting one. Formoterol is a class of medication called long acting beta agonist. So it's a combination of short acting, that is for the immediate action, and formoterol is for the long acting, that is a maintenance dosage. So initiating dosage, that is the loading dosage, as well as the maintenance dosage. The combination of that, that is the Foracort. Formoterol fumarate 20 mcg, Budecort, that is budesonide 0.5 mg for 2 ml. So formoterol remains same in the both the concentration, where the concentration of the budesonide varies, that is 0.5 mg, and our next one preparation 1 mg. 1 to 2 restfuls a day. Children's is not indicated. Inhalex, that is a Ambroxol, As we know, Ambroxol is a mucolytic class. It induces a watery secretion by targeting the secretory glands and the vagus nerve stimulation. It increases the hydration of the mucosa, resulting in easing of its elimination. So totally, it reduces by increasing the secretion. It causes a mucolytic action and reducing the viscosity of the mucus. So Ambroxol comes in 15 mg for 2 ml and adult or pediatric dosage is 1 to 2 spoons a day. So Mucinac, that is the Asthalin system. So most commonly used preparation I can say in the COVID era. Mucolytic class decreases the viscosity of the secretion, hydrolyze the disulfide bonds within the mucin, breaking down the oligomers and making the mucin less viscous. So it breaks the bonds within the mucin, and it is also used in clearing the endotracheal tube, clearing the airways, and we can use it for the nebulization also. That is the Astral system, 20% water for volume in 2 mg and 5 mg. The dosage for adult dosage is 3 to 5 ml. We can use 3 to 4 times a day. That is the dosage. Tobramycin, that is a tobamist, is an antibiotic which bacteriostatic which stops the growth of the certain bacteria like Pseudomonas aeruginosa that commonly infect the lungs in the people with the cystic fibrosis. So in those conditions, so tobramycin 300 mg per 5 ml. The adult and children dosage is 1 to 2 spoons a day for 28 days and followed by 28 days of drugs for the cystic fibrosis. The next solution is Hyperneb, that is nothing but the sodium chloride in the 3%. The whatever the for IV fluid we are using, that is normal saline we are using, that is 0.9%, and the 3% for the correction of the sodium chloride we are using in the IV form. So the same 3% solution is can be used here for the nebulization. Because of this hyperosmolarity, it reduces the mucosal swelling and decrease the inflammatory mediators and the viscosity of the mucus and improve the mucociliary clearance. So it comes in two forms, that is 3% and 7%. So in the adult and children's, one response to two we can use for 2 to 4 times a day. One response 2 to 4 times a day. The next one is the Glycohale, that is the Glycopyrrolate. Glycopyrrolate is an anticholinergic drug. It works by relaxing the muscles around the airway in your lungs and making it easier to breathe. Glycopyrrolate. Glycopyrrolate dosage is of 25 mcg. Adult dosage is 1 spoon 2 times a day, that is 12th hourly. We have seen the Asthalin, that is salbutamol bronchodilator. Levolin, that is the improved version of the salbutamol, which reduces the tachycardia and hyperkalemia. That is which is common in the salbutamol, and both can be used. Salbutamol can be used 3 to 4 times in a day, and Levolin, that is levosalbutamol, can be used 3 times in a day. Ipratropium bromide used in the COPD patients is the anti COPD and which prevent the bronchoconstriction. Asthalin and Levolin are the bronchodilator. Ipratropium bromide is the which prevent the bronchoconstriction. Duolin is the combination of levosalbutamol, okay, and the ipratropium bromide. Duolin is nothing but the combination of 2 and 3. That is levosalbutamol and ipratropium bromide. Budecort is a corticosteroid, that is short acting. SABA, short acting beta agonist. Fluticasone is a long acting. Okay, both can be used 12th hourly. Budesal, that is budesonide and levosalbutamol. This is a combination of number 5 and the number 2. That is the Budesal. Foracort, formoterol fumarate, long-acting corticosteroid, budesonide. That is the long-acting and short-acting combination. That is Foracort. Inhalex is a mucolytic, acetylcysteine mucolytic, Tobramycin, a locally acting antibacteriostatic. Sodium chloride 3% is a Hyperneb solution. Means high osmolarity solution which reduce the edema in the mucosa. Glycopyrrolate anticholinergic drugs which helps in preventing the contraction of the accessory respiratory muscles. So this is about the different commonly used nebulization uh, uh, nebulization solutions. If you like this video, then kindly subscribe to the channel and press the bell icon. And if you find it's worth spending time here, then kindly forward to the needed people. Thank you.